Hello. How are you feeling today? And how did you sleep last night? Chances are, if you had a really good sleep last night, then you're feeling a lot better today than if you had a poor sleep last night. Did you know that sleep is vital for our health and well being? We need healthy sleep to grow, to repair our bodies, and to literally clean out our minds, as well as storing and organizing the things we've learned throughout the day, our experiences, and our emotions. Sleep is like a recharge and a reset for both our minds and our bodies. When we're feeling unwell, we need more sleep to help us recover and get well again. And sometimes when we're feeling really unwell, we need to go to hospital. So you get lots of good sleep in hospital, right? Wrong. It's actually really tough to sleep well in hospital.
As someone who works on the pediatric medical unit, I understand the experiences and the difficulties that parents and caregivers and children might have with sleep in hospital. For example, noise that happens overnight from work that happens by the nurses, call bells from other patients, and the movement of equipment can have a big disruption on sleep for patients and the people around them. Sometimes, members of the care team may have to interrupt sleep on purpose to provide necessary interventions overnight. These can include blood work, medications, vitals, and for other emergencies that are happening on the unit.
In hospital, it can be hard to calm your mind enough to fall asleep.
It can be especially difficult for children with sensory issues and communication needs to sleep well in the hospital.
It can be hard to keep a hospital room dark at night. There's always flashing lights from the equipment and the monitors. There's light peeking through the windows in the hallways. And if healthcare professionals need to provide care, they need a light turned on. It's not just light at night that's the problem. There's also not enough light during the day.
One of the ways I support my sleep and my health is by getting exercise. But when you're staying in hospital, it's not often that you're able to leave the room. And sometimes you're not allowed to leave at all.
But there are things that we can do to help children and their families sleep better in hospital and when they go home again. And that's what we're doing with the Sleep for Health in Hospital and at Home projects. Shh.
We can raise awareness of sound levels to help reduce the level of noise.
We can help keep the body clock on time by increasing light levels during the day and decreasing light levels at night.
We can provide educational resources to families on what things they could do to try to support healthy sleep even while they're in hospital. We can work with healthcare providers to help reduce the number of disruptions to patients' sleep overnight while still maintaining high-quality, safe care.
We can provide information for families about how they can get into a great sleep routine when they go home again. One of the aims of our project is to ensure that all children and families achieve healthy sleep whether they are in hospital or at home. Some of the tips that we provide is reminding that good sleep is a habit, so follow the same routine every night to prepare for bed. Doing this sends messages to our body that it's sleep time and makes us more ready to go to sleep when we snuggle into bed. Try to use the same bedtime and getting up time every day too, including the weekend. Keep the bedroom quiet and cool. Avoid electronic games and devices, including TV, for at least an hour before bedtime, and don't have any in the bedroom. Make sure the bedroom is a pleasant, not too stimulating environment that is cool, dark, and quiet. Be careful about eating. Avoid caffeinated foods and drinks. That includes chocolate, for at least 6 hours before bedtime or even longer. Settle down solo. Allow children to settle off to sleep independently, perhaps after a short story or a cuddle. This will mean when they wake naturally in the night, which we all do, they will be able to settle off to sleep again without needing their parents to be there. A bright new day. In the morning, make sure there is bright light to provide a clear signal that it's daytime to help getting up time consistent.
And we can make sure that everything we do thinks about the needs of everybody.
We want to help everyone
Sleep well.
Et se rétablir
Stare bene.